Dandenong and Dandenong Chamber of Commerce. We're getting together to provide these series of 3 webinars to support people to get COVID ready, to prepare, to know what to expect, what to do, how to plan, and cover both strategy, give you some of the latest updates from experts, and also give you some concrete tips about how to support your business moving forward. Today is obviously the second in this series of webinars. Just briefly, the last webinar covered things like the COVID-Safe Plan, why you need to have one as a business, what your plan needs to include, how you can get more information, and yes, there is a template. What support is available from state government, what are the translated materials, and what are my obligations as an employer. And Tamara is going to put a link in the chat box, and I'll cover a bit more of that in a minute. And that link is for the all of the COVID related information, and I know that our guest speakers will refer to that today. Before we move on to the agenda, there's a few little housekeeping things that I'd like to let everyone know. One, you'll be on mute during the presentation sections of today, and then obviously we'll have the Q&A section after that. We will be recording and we aim to post this to our channels. For those of you who have questions, and whether they be technical questions or if you're having technical difficulties, then Tamara is the person to write to in the chat box. For the rest of you who would like to ask questions and who've already got burning issues that they want addressed today, then please put them in our chat box and we'll come to them in the question and answer section of today. And we encourage people, if you want to let us know what your business is, there's 3 ellipses in the top right hand corner. You're welcome to do an @ and then your business name if you would like. So moving on to today for the agenda. We've got a fabulous lineup of special guests who've got a wealth of experience to share. We've got a representative from Department of Health and Human Services. We've got someone from Council, quite a few people from Council to talk about the specifics, and obviously we'll have that question and answer section. So without delaying any further, I'd like to introduce our first guest. And he is from the Department of Health and Human Services and has an extensive and amazing history. For the last 12 years, Leigh's been Senior Industrial Officer at ANMF, which I think is ANMAC colloquially, Executive Officer for Asbestos Disease Society of Victoria, also National Executive Officer of the United Firefighters Union, plus Secretary of the Victorian Trades Whole Council, and is currently, and the reason why he's with us here today, the Community Engagement and Testing Command at DHHS. So please welcome Leigh Hubbard.
Thanks very much, Lisa. Can you hear me? Okay.
Yes.
Thank you, and thanks to everybody for participating in today's forum. I mean, I think the more of these we can have, the better. We just had one just before for all, effectively the horticulture industry across peri-urban Melbourne, which includes very much the piece of Melbourne that's out from where you are in Dandenong, obviously out towards Clyde and down into the Mornington Peninsula, and that's a pretty big issue at the moment. As Lisa kindly introduced me, I don't know whether you've seen Jerome Weimer, who's sometimes been on the Premier's press conferences in recent weeks about testing and pathology and the Northern outbreak, etc. I work sort of with him underneath Jerome with strategic advice around industry, and my main role is stakeholder engagement. So I'm not an expert, I'm not a health expert, don't pretend. If you've got curly questions about health, I can take them on notice and get back to you, and I've promised to do that. I've got a fair bit of knowledge about COVID-Safe plans and high-risk industries and what's happening around that. And so without further ado, I'll try and share my screen and just go through a bit of a 5 or 10 minute presentation. Is that okay? I can share my screen, Lisa?
Yes, definitely. And Tamara's going to help you with any.
Okay.
Yep.
So I'm going to share this one, I think. Can you see that?
Not just yet. There we go.
Okay. All right. So you can see all of that. So I'm, as I said, from the Department of Health and Human Services, from community engagement and testing. And as I say, my role is more in the engagement side, and that's a pretty important thing, really, because we've got both workplaces, businesses, as well as quite complex community organisations and communities, particularly in our culturally and linguistically diverse communities. There's a lot of complexity around that, especially when we have outbreaks. So our vision, and where I work, and some of this, if you were on the last one, you might have seen this because Mia might have presented this slide, just to remind you that basically our role is to engage and test across the Victorian community and define and contain the virus. And in our principles, what we're aiming to do end to end is to get people to test, to engage with them around knowing what the 6 principles are, and I'll come to those in a second, and then get the test results back to them as soon as possible, and then engage where there are positive cases, make sure that through contact tracing and outbreak management, they're looked after appropriately. And as you know, there have been some criticisms, sometimes probably quite justified, as we've gone on the journey across this last 3 or 4 months. We've all learned many things. And so just how to engage, how best to link into particular communities, is a learning thing. So that's who we are. Can you see that slide okay? Okay, so what we are aiming to do is build trust in the community. We're aiming to be inclusive. We're aiming to be informed by the best data and evidence. So how we target particular postcodes, settings, industries, that's something we're looking to the data to show us, and part of that data is what we collect every time someone goes to have a test, whether it's a negative test or a positive test, and so on. So just here in terms of targeted engagement, what we're seeking to do is interact with Victorians in their communities, in their place and in their employment. So it's people, place and settings basically, and that's what we're aimed at doing. And over time, originally when we started this back in March, we set up testing sites, and there are 210 fixed testing sites across Victoria now. We're now refining that because clearly it's not a strategy. Just setting up testing sites and say, come and be tested, isn't necessarily a strategy. Where we've got to is to try and shift some of those resources that have been in the fixed testing area into people, places and settings that might be vulnerable. So for example, coming up, we've got a summer season where if we're opening up, some of those seaside communities, some of those holiday places are going to be more vulnerable to virus circulating, people in closer proximity to each other, particularly around camping sites and caravan parks. So that would be a setting where we would target our response. But it's also in industries, and I'll come to higher risk industries in a second. So what we're doing is we're kind of trying to drive also COVID-safe behaviours. While we'd all like to think we can go back to normal and what we used to have before March, that's just not going to be the case for a long time until we've got a vaccine, and if we ever have a vaccine. So we've got to learn about new behaviours and new ways of doing things, and that's part of the value of a forum like this, to get people to start to think, what is my new COVID normal? That's really a very important thing that we've got to get across to businesses as they reopen. And I must say, it's a pretty tense time. I feel it right now. While it's exciting that we're moving, I also feel that tension that you've only got to look at Britain and France and other places. The minute they started to open up, then the cases started to escalate again, because not so much the behaviours of businesses, but people who just wanted to have fun, they wanted to relax, they wanted to do certain things they'd done before. That's not conducive to keeping numbers down. So we're part of our group, and with the testing and the pathology, we've got a very strong community engagement team, and Mia, who presented at this last forum, she was part of that. She's a co-lead of that. And so we spend a lot of time working with particular communities, and we've now got, for example, across Melbourne, 9 bicultural workers who are working with particular communities. We're doing a lot of work around seasonal workers and trying to get them to come forward for testing, etc. I think I'll leave this, but basically what we try and do is identify issues and who we need to get to when we have a particular problem. We try and identify and address the immediate barriers to testing and effective isolation. So just things like where to get tested, how to monitor people who've obviously been defined as close contacts. And then we've got obviously some more complex social, economic and cultural barriers to testing and isolation, about how you support families who are isolated, how you get people to come forward who may have reasons not to come forward, and so on, how we get through those barriers. So that's part of what the community engagement team, which is probably now about 20 or 30 people within our sort of command structure, that's what they deal with. And so basically, what our aim is to support the immediate outbreak response where we have an outbreak. And that's clearly going to be a lot easier as we've got lower numbers. Now you can see whether it's the northern suburbs of Melbourne, around Preston and through to Broadmeadows, where we've got an outbreak around a school and so on. We can jump on it much more quickly. Just a few weeks ago, obviously Dandenong, Casey, and then before that Frankston, there were some outbreaks, and we jumped on those in a whole multi-pronged way. Part of that is to increase the testing, and I think over the last few days in the northern suburbs, we've had something like 18 or 19,000 tests done in the last week, just in those few suburbs alone. We want to engage the community, and we want to engage with local businesses and industry. So and under that, there's a whole range of things that we can do, a lot of initiatives that we can take. Just in your area, you can see, back, you had a spike in September in Dandenong. You can see in Casey also, the actual number of confirmed cases has gone down. Thankfully, the testing rate has still stood up pretty well, and so you can see, I hope it's pretty hard probably to read that, but I got them to update this from a couple of weeks ago. It goes through now to the week of 24th of October, and yeah, the testing rate in both Casey and Dandenong is still pretty good. You're pretty well served with testing sites, and if there were to be a problem, there would be pop-up testing sites as well, and you should know on the website there's both a list each day of hotspots around the city, so things like a McDonald's where someone has been, or a particular venue where people should go and get tested if they've been there, but there's also the sites are all listed on the DHHS website. I just wanted to discuss with a number of business people on today's meeting, obviously, is the 6 principles about ensuring physical distancing, wearing a face mask, practicing good hygiene, keeping records and acting quickly if workers become unwell, avoiding interactions in closed spaces, and creating workforce bubbles. Now, they're the 6 real principles that have been adopted probably from about 2 months ago. And they're really at the basis of your COVID-Safe plans. Really, it's not rocket science, it's not complex. What we're asking people to do is think about their business and how, in relation to each of those principles, you can implement them and document them in a way that is effective. And you can see in the COVID-Safe plan guidance that's up on the website, the Business Vic or the coronavirus website, that there's examples of how you can do each of those. I want to come back to the workforce bubbles, because I really think that's a very important one. I mean, everyone by now, I think, has probably got hygiene pretty down pat, that distancing 1.5 metres. They've got the hygiene, the hand washing, the sanitising. Hopefully they've got the cleaning, and there are some new guidelines from DHHS, and I'll forward this presentation. I think Scott's got it already, but we can send it out to everyone. And the links are there to the new DHHS cleaning guidelines, which cover all businesses, and there are fact sheets as well for both site managers as well as cleaning contractors. But anyway, I think people have got that down pretty quickly, but I think probably what a lot of medium and smaller businesses haven't probably grasped as much as the workforce bubbles issue. And that's something I think we probably need to do. I'll come back to that. I think Lisa said you went through plans last time, so I don't want to dwell on this, but your COVID-Safe plan is in the left-hand column there. That's what most businesses are required to do. Every business who's permitted to open has to have a COVID-Safe plan. There are some industries like meat, poultry, seafood, supermarket distribution centres, chilled distribution centres for perishable foods, seasonal work, aged care and other care facilities that must have high-risk COVID-Safe plan, and they'll certainly have additional obligations. So you've got two sets of directions.
Listen to this.
You've got two sets of directions that the Chief Health Officer issues. One is the workplace directions, which really set out what's to be in the COVID-Safe plans. And then you've got these workplace additional industry obligations directions, which only apply to certain higher risk industries. And most of you won't be in that category, but it's worth knowing about it because they do have additional obligations, including superior workplace bubbles, surveillance testing. They actually have to have their staff tested, or a percentage of them tested each week or month. And they also have to have a thing called COVID marshals. And I'll come back to that because I actually think it's probably not a bad idea if you're a medium-sized business in no matter what industry, looking at the idea of COVID marshals. And I'll come back to what they are in a second. But on the left-hand side, the COVID-Safe plan, it's meant to be developed in consultation with if you've got health and safety reps in your workplaces. It's meant to be kept up to date, and for you to keep thinking about how to improve it. You really need to share your plan with your staff so they're educated. Available technology. So I went out. It was a great night last night. Went out to the pub for the first time in 12 weeks. And when I walked in the door, they had the QR code there. You scanned the QR code with your camera. Up came the questionnaire. You filled in your name and your phone number and your email, etc., and just submitted it. So that the venue had my details without any fuss, without paper and pen. They had the details. Now, there are many versions of this. There's a thing called COVID Pass that you could use. There's other versions, technological solutions, which you can even send out to people, say, who are booking a table in a restaurant before they get there, so that they can actually submit it online before they actually get to the venue. So these are simple things, but there's the 6 principles. You've got to outline in your COVID-Safe plan the actions you'll take to meet your requirements. You've got to record all of the people who enter the workplace, whether they're visitors or workers. You should screen workers before they enter the workplace. You're not required under your COVID-Safe plan to ask them health questions, but if someone has symptoms, they simply shouldn't be at work. That you should say, go and get a test. They shouldn't be in the workplace if they've got sore throat, runny nose, temperature. They shouldn't be there. And if they do turn up to work and they develop those symptoms, they should be sent home and they should be isolated before they're sent home, and you should try and help them get transport home or to a testing site so they can be tested. You also need to have a plan about what happens in the event of a positive case, because may happen in the future to you. Just need to be aware of the kind of risk assessment you need to do. And that risk assessment relies on all that work you've done in your COVID-Safe plan. So how you have tracked and recorded people, the bubbles you may have created in your workplace amongst your workforce to stop transmission across the whole workforce, etc. So your risk assessment, which would be prepared and DHHS would look at, is going to be very crucial to what happens, whether you're closed or whether only part of the business is closed, etc. So that's your COVID-Safe plan, and there's plenty of material on those two websites I've put down at the bottom of that slide. I did mention the COVID Marshal. The COVID Marshal is a person who may be doing their other duties at the same time, but in bigger workplaces, they'll sometimes have part of their time will be allocated only to COVID-19 duties. And that is really to make sure they're there to monitor that what you say you're doing in the COVID-Safe plan is actually happening. Because you know what it's like. Often we can put these things in a plan, we can write them down, but people get complacent. Things don't happen quite as you'd like. There's congestion points that you didn't realise might be there in your work, in doorways, whatever it is. And it's about somebody being another set of eyes and ears to watching out around your plan. And then reporting it both to management, and if there are health and safety reps on site, they can report it to them as well. But try and, in a timely way, get things dealt with. And if there's non-compliance among staff, for example, you've asked them not to all gather together and have a smoke out the back, but they continue to do it, then it's a way of raising those issues with them. So the COVID Marshal, you'll find some information on the coronavirus webpage, vic.gov.au, and I've put the link a little bit further on here in the in this presentation. Workforce bubbles, I still come back to that. This is only it's one of the 6 principles, and certainly in the higher risk industries that I mentioned, the ones that have got the additional obligations, they're really required to take this very, very seriously. In other words, for example, in a meatworks, what they've done in a boning room where they've got 40 workers, they will split those 40 workers in, say, 5 groups of 8 people or 4 groups of 10 people. They will become a bubble each. They will work separately. They will even come into the room separately. They will take their breaks together and not mix across the bubbles. And so that's the idea of a worker bubble. So if somebody inside that bubble has coronavirus, the idea is that it doesn't spread from that bubble across the whole 40 workers. You've got only 10 workers who would be required to be isolated as close contacts. So
Leigh.
Yep.
Excuse me, Leigh. Sorry, I'm just quite cognizant of time and our time frame. And I also note that before you offered to share your presentation, so it looks like a few other things, we've had a couple of questions already, which we will loop back to in the question and answer section, if that's okay.
Give me 2 more minutes. If it's 2 more minutes.
No problem.
No problem.
Yeah.
Okay, so if you can just look at that worker bubble stuff, because even in small workplaces, even if it's keeping your kitchen separate from your floor staff or your admin workers separate from other staff, that's a good thing to do. There are resources, as I said, there's a new set that's just come out, and I've put the link there from our infection control team. They're very comprehensive, and there's a whole range of resources that will be made available. There's also what to do in the case of a confirmed case in a workplace. There's a document that shows you what the risk assessment process would be. We are doing targeted industry testing in a number of industries, care facilities, meat, poultry, seafood, seasonal work, and we'll go to others in due course, particularly things like commercial passenger vehicles, childcare, cleaning, and perhaps security. And there are the PCR test at the moment. It's a bit uncomfortable. A lot of people don't like it or tolerate it very well. That's the nasal and throat swab. We are looking now and trialling saliva testing, rapid antigen testing, and there's a thing called LAMP testing, which is quicker. It's not necessarily any more comfortable, but those saliva testing, we're hoping by Christmas will start to be rolled out in a much in a larger scale way. So hopefully that will encourage more people to come forward for testing. And when we do industry testing, workplace testing, that's what it will be mainly. There's a lot of business supports, and DJPR, I know, have been working with the council very effectively to go around particular There's a lot of industry support packages available, and there's also the DHHS coronavirus hotline, and WorkSafe have a lot of information on their website as well. So I'd urge you to, if you can't find what you want online, just please ring one of those hotlines. Certainly DJPR have an industry coordination centre and information line. So really that's it. Thanks, Lisa. Sorry to take so long.
Not at all. Thank you so much, Leigh. Lots of valuable information there.
And I'll stop sharing.
That's fine. So to introduce our next guest, we have from the City of Greater Dandenong, who is the Manager of Business and Revitalisation. Please welcome Kevin Van Boxtel.
Thank you, Lisa. I think Holly's going to share her screen because we're sort of sharing this presentation. So hopefully we can get that up.
Just bear with me one moment.
All right. Thanks, Holly. So I'm the Manager of Business and Revitalisation with the City of Greater Dandenong, and Holly DeMaria is also going to be joining sort of in this presentation. She's our Coordinator Placemaking and Revitalisation, and together we just want to give a high-level overview, I guess, of some of the work Council's doing to try and facilitate as much as possible people returning to our activity centres and neighbourhood shopping centres and places of business during this period. So we're going to focus on outdoor dining today. I might just go to the next slide if we can.
Yep, sorry, I'm just having a few
Jump
issues.
back
Bear with me a moment.
I guess the key focus of what we're talking about really is, outdoor dining, and we're trying to assist as many businesses as possible to try and, those that have had to close because they weren't able to transition or offer, say, takeaway dining opportunities. We're obviously trying to have those businesses reopen through the changes that have occurred this week. So we've got some dining permitted indoors, but the focus of this discussion is predominantly about the dining opportunity outdoors. And a lot of that's geared around the public realm that council controls, although some of this crosses over to also into opportunities on private land. Not sure if we've got any luck there moving that forward, but yep, that's it. So we might jump straight to this one. So I guess the very important, there is financial support through the state government for this program. So the state government, I think, allocated $58 million for businesses to apply individually directly to the state. This is all able to be done through the Business Victoria website, and there's a link at the end of our presentation to the appropriate page. But essentially businesses can apply for grants up to $5,000 for the items that are mentioned there. So predominantly it's around furniture for outdoors, umbrellas, tables, chairs, screens, etc. But they can also use some of this funding for other things such as marketing, training, and other initiatives. So there is some eligibility criteria, so it is important to read that if you go online, if you're a business inquiring and interested in pursuing these grants. Definitely have a look at the website, definitely have a look at the eligibility criteria, and definitely lodge your application as soon as possible, because at this stage, the program is likely to be open up until the 11th of December, but it is flagged that it could close earlier when funds are exhausted. So it's very important that all local businesses in Greater Dandenong get applications in as quickly as possible for this financial support. There's also a link on our website. Our webpage is there, Greater Dandenong Outdoor Dining. Again, that's at the end of our presentation, and we'll make all these slides available. You're more than welcome to click onto our website, and we also have a direct link to the state government website. Probably just one sort of technical point to mention there that, prior to purchasing your furniture, you may want to check with council just to make sure the furniture you're purchasing is compliant, so that, that your money is well spent, so to speak. I won't recover these items. Leigh's covered them really well. These are basically the 6 principles that were talked about, but I will draw your attention just to that document that it covers on the top right there of your screen. It's the Industry Restart Guidelines Hospitality, dated October 2020. and this document's getting regularly refreshed by government. Again, there's a link at the end of the website to this document, but it basically outlines, yeah, all aspects, I guess, of the information that businesses need to know about opening and trading in this current environment. So it covers things like density limits, it covers seating spacing, it covers limits on the total number of people that can be in any one location, whether it's indoors or outdoors. As Leigh also mentioned earlier, it's very important, all businesses now must have a COVID-Safe plan. And as part of Council's work, we'll be shortly dropping off a flyer on outdoor dining to all our businesses across our activity centres, but we'll also be providing them with COVID-Safe packs, which have quite a lot of detail around material that can assist them in compliance and awareness around COVID safety. So that's quite important for businesses. And it also will have contact details of relevant officers from our environmental health team and other parts of council should you need any support. But essentially, yeah, what's flagged is here, and there's a quick summary, I won't go into this too much, but for metropolitan Melbourne now, in terms of outdoor dining, you can have a maximum of 50 people per venue, but there are density requirements around 1 person per 2 square metres. And there's also a spacing requirement of 1.5 metres between groups of people set up in those outdoor areas. So obviously the amount of space available outdoor is dictated by the sort of dimensions of footpath widths and the particular environment that a particular business is located. And Holly will now sort of step through, I guess, the 4 key scenarios that we're trying to promote through Council's work.
Thank you, Kevin. So Council understands that this year has been very difficult for many businesses, but particularly the hospitality sector. So behind the scenes, we've been working to make outdoor dining as easy as we possibly can for our hospitality businesses. So we understand that not every business is the same and not every situation is going to be identical. So the first, across the board, all outdoor dining permit fees have been waived until the 30th of June 2022. We've also developed 4 key options, which I'll go into more detail in a moment. First one being footpath trading, expanded footpath trading to adjoining properties, curbside car park trading, or pop-up community outdoor trading. As Kevin indicated, there is information on this on our website, and we'll have some handy links later on. The other key piece of information is that all outdoor dining permissions need to abide by the most up-to-date advice of the Victorian Chief Health Officer. So no matter what your permit says, that's the final word, is what the Chief Health Officer says. So firstly, the footpath dining trading, this allows businesses to trade directly outside on the footpath of their business. So this was essentially the pre-COVID usual approach that we had. And if you have a current footpath trading permit, you don't need to have any additional approvals to continue on as per usual. The next item is the expanded footpath trading to adjoining properties. So this option allows businesses to temporarily expand their footpath trading to in front of their neighbouring businesses on either side. So it is important to note that as part of this application, as part of applying for this permit, you do need to consult with your businesses, with your neighbouring businesses, and there's an engagement form on our website which you're asked to fill in and say who you spoke to and when, and that allows council to touch base with them through the application process. For this option, a site plan should be sketched up and prepared that shows what items you'll be placing outside your neighbouring shop fronts. The third option is curbside car park trading. So this option allows businesses to use car parking spaces that are at the front of their business or for curbside car park trading. And there's a few example images from around the world, and there's many out there if you do a Google search. So again, you will be required to consult with your neighbours and complete an engagement form on this if you were putting in for this option. And it's also important to note that not all businesses or locations are going to be appropriate for this option. So curbside car park trading permits will only be issued where it's safe and practicable. Expressions of interest are required to be put into council, and council will work on a case-by-case basis to assess the locations and consult with other authorities as required. The fourth option that we have is the pop-up community outdoor trading. So this allows businesses to establish an outdoor seating space in designated areas, such as roads, curb out stands or other areas. So this might include a group of businesses who are collaborating together to form a larger outdoor dining area where each business looks after a specified area. For this option, a footpath trading permit is still required, but council can assist with some of the necessary safety infrastructure if this is something that is put forward in the expression of interest. Again, this option includes a sketched up site plan and information on how the space will work, including who will be looking after which element, who will be taking care of the cleaning, the monitoring, etc. And again, these will be assessed on a case-by-case basis and, depending on what's required, referred to and consulted with other authorities as well. So information on all of these options and the application forms are available on Council's outdoor dining webpage. The links are here, and as we've said previously, the slides will be shared. Council is dedicated to assisting our local hospitality community as best we can. So any business is welcome to contact us and discuss their unique situation as well. And there is the business and revitalisation email there listed there too. So I think we're holding off for questions at the moment. Lisa, is that correct?
Sorry, yes, that's correct. I had to unmute myself. Hold off to questions at the end. And I know that quite a few people have started to put questions in the chat box, if that's okay. We've got another presentation as well from a guest speaker. But thank you so much, Holly, and thank you so much, Kevin. Really great information about what's relevant to some of our hospitality, and for those who are going out to hospitality venues, it helps to know what the requirements are and what to expect. Our next guest presenter, also from City of Greater Dandenong, is our Environmental Health Officer, and that's Rebecca Jones. Thank you so much, Rebecca.
Thank you, Lisa. Look, I'm here to talk to you about COVID-Safe Plan practical solutions. So the Public Health Unit with Council have put together this presentation. I will just share my screen now. Here we go. All right. So as we all know, everyone is required to have a COVID-Safe plan if they want to open their business. So basically, this has been covered, so I won't spend too much time telling you why you need a plan, but it's basically to reduce the spread of COVID as much as possible. We do have these posters available. We've got COVID-Safe Plan information kit. So most of the posters you see will be available in that kit. So your COVID-Safe plan does need to be a written document, and as stated by our previous speakers, it needs to cover the 6 COVID-Safe principles. So physical distancing is one of the most important criteria. So we need to remember that all indoor spaces are only allowed to have 1 person per 4 square metres. And for your outdoor dining areas, it's 1 person per 2 square metres. So in the pack, you will see our poster for the maximum number of patrons that are allowed in your premises at any one time. It's also a good idea to have some posters like this around, just reminding your customers to stay 1.5 metres apart. In the pack, you'll also find this document on how to figure out how many people you're allowed in your floor space area. So there's just a quick guide with the metres squared and the number of people for indoor and outdoor. Also, there's a quick example of how to calculate your floor space and the number of people you can have within it. It's a great idea to have some floor markings in your premises, especially at cash registers, but also maybe for your staff as well. So if you've got places where your staff tend to group up together, you might want to put some floor markings down there to try and encourage them to keep the 1.5 distance apart as well. Also, your perspex barriers are a really good idea at your registers where it's often hard to maintain that distance. If you've got shops with aisles and things like that, you might also want to consider having arrows on the floor, so you've got your customers walking in the same direction through your premises. And likewise, if you've got two entries into your premises, you might want to dedicate one of those entries as an entry and the other one as an exit. So we all know that we're going to be wearing face masks for a while. So everyone entering your workplace, whether they work for you or they're a visitor, must be wearing a face covering. So a lot of our proprietors and business owners are supplying face coverings for their workers, which is great. Now I've got a quick video that shows us how we should be wearing our masks. So let me just see if I can get that working. Okay.
Hi, I'm Alison McMillan, Commonwealth Chief Nursing and Midwifery Officer. If you need to know how to wear it properly to make sure it's effective. Protect you and the people near you from spread the virus. Wash your hands for 20 minutes in water or an alcohol. Secure the mask ties in the middle of the back of your head and neck, or slip the elastics over your ears. Make sure it covers your nose and mouth. Fix the flexible band to the bridge of your nose with the mask sitting snugly to your face and below your chin. While you're wearing a mask, do not touch the front or allow it to hang around your neck. This includes when eating and drinking. If you do touch the mask, wash your hands immediately. If your mask gets wet or is damaged, it can no longer do its job, so replace it. When it's time to remove the mask, use the ties or elastics and be careful not to touch the front of the mask. Single-use masks should not be reused, but discarded immediately after use. And then, of course, please hygiene your hands again. A face mask is not a substitute for the precautions we know prevent the spread of COVID-19. Staying at home if you're unwell, that physical distancing, staying 1.5 metres away from others, frequently hygiening your hands, and cough and respiratory.
Okay, hopefully you found that video informative. So good hygiene practices. a lot of our places already have a hygiene station at the front door with hand sanitizer, and it's a very important station to have at all your business front doors. That way people coming into your business are using the sanitizer before they touch anything in your premises. It's also important to have hand sanitizer in convenient and easy to use places for your staff. So if you have cash registers, you definitely need to have some hand sanitizer at the registers, and try to promote cashless payments, because touching cash is one of the reasons why we definitely want to have the hand sanitizer at the cash registers. Now, you regularly need to clean all of your high touch areas using an antiviral disinfectant. So high touch areas such as FPOS machines, handles to doors and fridges and cupboards, the counter surface, anywhere that you find multiple people are touching multiple times through the day. So where possible, also leave doors open. So if you can leave your front door open, it will enable people to enter and exit without touching another handle. If you've got baskets or trolleys available for your customers, it's a good idea to provide disinfectant wipes for those as well. It's important to note that hand sanitizer does not replace hand washing. So if your hands are starting to feel sticky or are visibly dirty, you need to wash your hands properly with soap and water and ensure they're properly dried. So keeping records. We all know how important it is to have an attendance register so that we know who's in our business and when. So all of your normal workplace staff definitely need to go in here, and anyone who might be coming into your premises for more than it would also go onto this register, and it must be kept so that if we do have a COVID case, it's very quick and easy to do the contact tracing. So as much as possible, avoid interactions in open spaces. So if you can have a meeting outside, especially on a beautiful day like today, definitely do that. Airflow, if you can have your doors and windows open in your premises and encourage that fresh air, do that as well, because keeping the airflow nice and fresh will also help reduce the risk. I think Leigh covered workplace bubbles really, really well, so I won't bother going on about that again. Just that if you do have shifts, it's definitely a good idea to stagger those shifts so that you've got maybe 15 minutes to half an hour between one shift ending and the new shift starting, just so that you don't have those congregation of people during shift change. So thank you again for your time and for listening to me. We do have COVID-Safe information packs available. So these packs include a simple COVID-Safe plan template and guidelines, the template for the workplace register, also the document on floor space calculations and the number of people allowed into your premises sign, and also a few other practical safe measures for COVID prevention. So if you would like one of those packs, you can send us an email to the address on the screen there. If you would like a hard copy, we're happy to post them out, or we can email you a soft copy. I believe we're taking questions at the end. So thank you again for listening. I believe Scott is next. Is that right, Lisa?
Yes, absolutely. Thank you so much, Rebecca. Really appreciate your presentation and some of the advice that businesses can implement immediately. I'm very aware of time. We've got only a couple of questions sitting there. Our next and last guest speaker is from City of Greater Dandenong, and he's the Emergency Management Coordinator. Please welcome Scott Walker.
Thanks, Lisa. Hello, everyone. As Lisa said, I'm the Emergency Management Coordinator. I'm not going to take up too much time, and those who have heard me talk, I could talk on this subject forever. So I'd rather get questions and get feedback from everybody, but please be sure that all the speakers here and our team at Council, we are thinking about you every looking at all the types of things that we could do to support you for providing this platform. I'd like this to be a two-way conversation with your organisations and our organisations. I've got the kits, we've got signage, we've got temperature gauges, the examples that you saw on the screen there about the hand sanitising stations, they were produced by a company in Keysborough. I can give you those details. Dots on the floor, all that's available. So the information that you've heard today is a lot to take in, and I get it. If you've got any other questions, email us, call us, and let's have those conversations. So that's all I really wanted to say. And I'll hand it back to you, Lisa, and we can go through some
Fabulous.
Q&A.
Thank you so much, Scott, and thanks to all of our guest speakers. So I've got the first question here, and what I might do is throw it open and ask one of our specialists to nominate that they're going to answer the question. This is a question from Narosh. My business is an open area, no doors. And basically when customers come and eat, do I need to record their names too?
I'll do that, and Leigh, maybe you can jump in. So if you're having interaction with customers for more than 15 minutes or more, then we need the details. You need. Let me tell you what would happen if you had a positive outbreak in your business or a positive case comes into your business. Is very quickly you'll get a phone call from DHHS and or council saying, we need your records, we need to know who was in your premises, probably going back about 2 weeks. And then we need to know how long they were there, who they were, and that's how the contact tracing wraps around that particular case. You saw it with the Chadstone outbreak just recently, which went to Kilmore and went to Shepparton, and there's people in DHHS that are doing this full time now, thousands of people in the contact tracing area, and because the numbers are so low, as Leigh said, the capacity to do that extra work. So yes, 15 minutes or more, we need to know who the details are. The details. It's person's name, and if your location has multiple entrances, we need to know how they moved through your business. Leigh, if you want to add anything to that?
No, I think you've covered it pretty well. We even were talking about this, about self-picking, on horticultural properties earlier today, and how you've got to actually know who's on your property and where they might have even been. So while you're only required to record the name and the phone number, it's always good if people are wandering around to know where they've been, for example, if you've got a larger business.
Fabulous. Thank you, Scott. Thank you, Leigh. In our chat box, there was a question from Marv to everyone about accessing the kits and signage, and Tamara has put the email address that you can write to access those kits that were spoken about. Time includes staff in a close. Ravinda, I've got a question from you, and it says number of patrons at a time includes staff in a closed. Is that correct? Okay.
Rebecca, I would recommend reading through the Hospitality Restart Guidelines to give a bit more information on that one. I don't have the answer off the top of my head. Rebecca, I don't know if you do.
So for, indoor spaces, there's a cap of 10 people per indoor, maximum of 20 patrons per venue. So that, I'm presuming, is just for your patrons, and your floor space is actually calculated on the area of the floor space available to your patrons. So it of 10 people per indoor space. So that's customers, not staff. And as I said, with a maximum of 20 patrons per venue. So if you had 2 separate, you could have 10 people in each of those separate indoor spaces.
Thank you, Rebecca.
At the moment, it does change with the restriction changes. Sorry.
So there's a question just seeking clarification, and this is from Janice, and it's a 15-minute rule in particular. So it's a question in regard to takeaway food practice. If someone isn't there for 15 minutes and or there's an interaction of less than that, what is needed in terms of contact tracing?
Leigh can come on. So 15 minutes is the guideline. The capacity in your business to record, maybe it's cameras, maybe it's QR codes of everybody that's coming in. It helps us in emergency services effectively do that contact. So you think of a takeaway cafe. If you have people dining and sitting down and they're there for more than 15 minutes, you need their details. If they're coming in getting a takeaway coffee and they're there for 2 minutes, then the requirement is at the moment, no, you don't have to record their details. I'm suggesting that that is the minimum requirement that we would be looking for. Somebody is there and they are getting takeaway food and they have to wait for more than 15 minutes for that to be prepared. A lot of cafes in Dandenong are asking people to wait outside to spread out to reduce that risk. If you are interacting with those people in your business for more than 15 minutes.
Fabulous, thank you so much. Now from Leanne, there's a question about surveillance testing. So how and when could be access surveillance testing if needed? What is the criteria for this? Might that be?
If I could just, surveillance testing at the moment is only particular industries. So generally the public can't testing if they're not symptomatic. So you have to be symptomatic. There is that, as I said, for meat, poultry, seafood workers, seasonal workers in horticulture, and so the list go on. What we're doing with testing is increasing the capacity for about low 20,000s a day, and you'll see in the last few days we've actually 4,000 over several days. We're aiming to increase that to 35,000. A proportion of that can be targeted at industries that are more high risk. Now that will be kind of a bit of a evolving thing about which industries are chosen or targeted in that. So generally, you just can't be a business and say, I'd like to get work and then rock up if you've got no symptoms. Generally have symptoms unless you're part of surveillance testing program. So yeah, it's not available to everybody really in those industries that are targeted.
There's another question, and this is from France de Silva. And Rebecca, I think this might lean towards people putting their mask down around their asks about seeing leaders put their face mask in their pocket and then reuse it. And that's not a disposable, but it's a washable face. Can you make a comment on that, please? Looks like it's a... I don't have any further questions. Is anyone who would like to perhaps ask a question verbally, or is there any other questions people have? We've probably got 1 or 2 minutes. If you think of a question after today, you're more than welcome to contact Scott Walker and he'll have his details and be able to follow up with any questions. Otherwise, you're welcome to contact the chamber and certainly put it to the appropriate person and come back to you with detail.
So I just had one question, I guess, for our audience, is as we're all customers ourselves, and my question to you is, comfortable, what would you think is a really well prepared COVID safe? Is it a business where the staff have their masks around there and there's no sanitizer and there's no social distancing and it's a bit of a mess, or would to go into a business that has all that in place? looks safe, and I would suggest that we would feel more comfortable going in that makes you feel good about it. So my challenge, I guess, to everybody is keep that in mind, and whatever council can do to support you get to that space and get to that level for your, that's what we're here to do.
I think very well said, Scott, and certainly a thought that everyone needs to consider in the coming months when we go COVID normal. Just looking, there's many thanks to everyone, no further questions. So without delay, thank you so much to everyone who participated. Really appreciate all of our special guests, and we'll be having a third session, which is an additional webinar in the coming weeks. So please look out for that, and it'll be advertised through the chamber. Thank you again to everyone, and enjoy the rest of your day.